again, everyone. It is July 28th. It's almost 11 o'clock in the evening, Eastern Standard Time here. And I just wanted to make another one of these videos. I am John. I'm the owner of this channel, SFN Life. It stands for Small Fiber Neuropathy. And if you learned something or want me to continue making these videos, please hit the like button and subscribe. I'm trying to start building a bigger following so I can have more education and awareness out there about conditions like small fiber neuropathy, like CRPS, like autoimmune illnesses, post-viral illnesses, mold illness, chronic Lyme disease, all of those related things. Long COVID especially too has been in the limelight for a while now, and many people with long COVID meet the criteria for chronic fatigue syndrome, myalgic encephalomyelitis. So that's going to be an additional focus that has heavier weight here. Anyway, I just wanted to make this topic tonight about how there have been a number of studies that have shown that people with chronic fatigue syndrome, myalgic encephalomyelitis, have more naive memory B-cell, or more naive, let me get it right here. People with chronic fatigue syndrome or myalgic encephalomyelitis have more naive B cells than healthy controls and fewer class switched memory B cells that can recognize things going on in the immune system. So with more naive B cells, that kind of puts us at a higher risk for having some immune issues. And I just wanted to mention there was a paper, an NIH, National Institute of Health news release in February of this year, 2024, where spinal fluid was collected from participants, and it was found that there were abnormally low levels of catecholamines and other molecules that help regulate the nervous system in people with ME/CFS compared to healthy controls. Reduced levels of catecholamines were associated with worse motor performance, effort-related behaviors, and cognitive symptoms. These findings for the first time suggest a link between specific abnormalities or imbalances in the brain and ME/CFS. That paper also said immune testing revealed that the ME/CFS group had higher levels of naive B cells and lower levels of switched memory B cells, cells that help the immune system fight off pathogens in blood compared to healthy controls. Naive B cells are always present in the body and activate when they encounter any given antigen, a foreign substance that triggers the immune system. Memory B cells respond to a specific antigen and help maintain adaptive or acquired immunity. More studies are needed to determine how these immune markers relate to brain dysfunction and fatigue in ME/CFS. So that was released in February this year. I just realized my fans on my laptop are on, so I'm going to turn those off. Hopefully the audio has been picked up okay. Also, I was kind of curious to get some information on long COVID as well, of course, because of the link between them. But since this channel is related to small fiber neuropathy, I wanted to talk about that first. And at meassociation.org.uk, there is information listed on a study that was done in 2020 that talks about small fiber polyneuropathy and how it may underlie dysautonomia in ME/CFS. So there is a link there. I will post a link to that study. Cimarron Research Institute, Ryan Whalen was quoted as saying, given the overlap of symptoms and common etiological basis, it may be important to identify ME/CFS patients who present with comorbid AA-SFPN, apparently autoimmune small fiber polyneuropathy, as it has been shown that immune modulatory agents, including intravenous immunoglobulin, IVIG, reduce the autonomic symptom burden in AA-SFPN patients. And I can tell you that I was on IVIG for about 2.5 years, and it did reduce the autonomic quote from the article from Whalen. Valuable because ME/CFS has always been looked upon as just subjective symptoms. When people have lab abnormalities, it can be due to a bunch of other causes. But here is pathology. Here's a biopsy of actual damage. It's not just a transient finding. You can actually see it. It's a solid, concrete piece of evidence versus something that can fluctuate. And I think that that's really important, not only for ME/CFS, but for long COVID, because likely if a study were to be done on long COVID, which I also have a diagnosis for, so, you know, another reason to get involved with bringing awareness and education about the conditions. Another study could and should be done for long COVID patients, pathology there as well. I belong to a number of groups, and I just see over and over again medical gaslighting happening for people that are sick like me, and it's not okay, and it has to change. And the problem is we're all sick, so it's very hard to make changes like that. That's all I have for tonight. I just wanted to keep it shorter. I'm trying to aim for really under 3 minutes. It seems a bit longer. That's okay. Hope you enjoyed listening, and here soon I will be